I'm joined by Dr. Kasey Harbine of St. Pat's for another edition of Morning Rounds. Thanks for joining us this morning.
Yeah, thank you.
Today our topic is rabies. Why do we talk about rabies this time of year?
Well, and actually the late spring and the summer is the most common time in Montana that we come in contact with animals who might be infected with rabies. And so it's an important reminder to be aware of that.
What exactly is rabies?
So rabies is a virus that affects our central nervous system. So our nerves, our brain, it can ultimately can cause brain dysfunction and death. The early symptoms might just be fever or headache, muscle aches, that kind of thing. Later signs of rabies are things like hydrophobia, fear of water, hypersalivation, hallucinations. These are much later symptoms of rabies and usually mean that death is near.
How do we come into contact with rabies? Obviously, animals can get it, and if we have contact with them, but is that the main way?
Well, rabies is actually transmitted through saliva of an infected animal. So if you get bit by an animal who has rabies, then that's how the virus is transmitted. The most common four-legged animal in nationally, but particularly in Montana that has rabies are skunks. We do a pretty good job of avoiding skunks, so we're not usually inadvertently playing with skunks, but they are actually the biggest carriers of rabies. Most common way that people in Montana become infected is actually from bats. And bats can get into the homes this time of year. They fly through the windows. Maybe we're going out to our cabin for the first time in a while, and they've been hiding out in the cabin, getting in under the eaves. And actually, you can get bit by a bat and never know that you were bit.
So what do you do if you have come into contact, been bitten by an animal that you're concerned could have rabies? What's the steps you should take?
Well, you need to wash the bite immediately. That in and of itself can really help prevent transmission. If you're able to capture the animal without further getting bit, that can be really helpful, because if you're able to prove that the animal that bit you did not have rabies, then you can avoid a lot of the hassle of going through post-exposure treatment. It is really helpful to contact the health department, particularly if you have questions. I've been bit, what should I do, where should I go? There's treatment if you've been bit, so either if you're unsure if the animals had rabies or in fact they did, you can get some post-exposure treatment. This can end up being very, very expensive. So it involves initially a dose of rabies immunoglobulin that needs to be delivered in the hospital or in the emergency department. This can actually be upwards of $10,000 for a normal-sized adult. And then you need 4 vaccines, post-exposure vaccines, that need to be administered through the health department over a period of 14 days. So it can really add up, and it's insurance dependent if it's covered.
So how can you prevent rabies, or I guess avoid it?
Well, in general, it's recommended not to feed or handle wild animals. Make sure that your pets are vaccinated for rabies to protect them. Bat-proof houses. Make sure you have screens on the windows. If there's any in your cabin, any place where animals could sneak in, maybe kind of block those off.
All right. Well, thank you so much for answering some of those questions for us in this edition of Morning Rounds. If you have a question you'd like us to answer, you can just email it to us, morningrounds@kpax.com.